Hi, Sora. Have you cleaned your hands today?
Yes.
We are diving into patient empowerment today, and I am really curious to hear your take on it. No right or wrong answers here, just your thoughts, experiences, and maybe even a few unexpected insights.
I think at the first instance will be super paiseh and embarrassed that I need someone to remind me to do something so fundamental and simple. But I think more importantly, I'll be quite grateful and appreciative, because actually it just kind of shows me that the patient is also actively engaged and involved in his or her own care. So for that, I'll be quite thankful to the patients. It is actually more telling of the relationship between the patient and doctor, that there is actually open communication and that the patient is actually comfortable enough to tell the doctor when something is off or that something needs to be improved. So actually I do think it's actually a positive sign than anything else. The first major issue really is the time constraint, as well as the busy morning walk rounds or clinic consults that can make us sometimes forget that we need to do our hand hygiene, although we know that it's important. Usually there is fatigue and lapses in attention, as well as recalling that we actually do need to perform hand hygiene at the critical moments where we interact with patients. Second issue is usually there is a perceived hierarchy in the structure within the healthcare setting, whereby sometimes the junior staff may not be too comfortable to speak up to the senior staff, especially when they observe that there is actually a lapse in hand hygiene. Most importantly is don't take it too personally. I think just say a simple thank you, and it will actually go a long way in terms of maintaining collegiality amongst healthcare professionals with the patients, and really in building trust in ensuring that there's compliance with hand hygiene.
The top 3 common misconceptions of healthcare workers have about hand hygiene will be: first, the belief of donning a pair of gloves could substitute the need for hand washing. Secondly, the belief of using hand sanitizer will be as effective as performing hand hygiene. And lastly, it will be not necessary to follow the proper 7 steps of hand hygiene. When I was performing a medication round to my patient, and the patient himself is the one who asked me whether, "Nurse, have you performed your hand hygiene before serving the medication to me?" No, I don't feel professionally challenged, because I feel that the patient has the right to inform us to perform hand hygiene. Best way is to being open and being receptive when being reminded to perform hand hygiene, be it from our peers, patient, or even their relative. The most important aspect to prevent the chain of infection will be performing hand hygiene.
I remember once when my husband was ill and hospitalized, the nurse was trying to help him to get out and sit up. I saw that she wasn't doing the hand hygiene before she touched my hubby. So I politely asked her, please use the alcohol rub so that it will be safe for the patient. I did not do it in a rude manner. It's just to gently remind her that it's for patient safety that she needs to do the hand rub. I feel that this is definitely necessary if they are not doing their hand hygiene properly. It's important that they do the hand rub before touching the patient, so that the germs will not be transmitted to the patient. I don't think it's the fact that they shy away. In the busy schedule, when you're rushing from one task to another, it is very likely that sometimes you forget. So hopefully it will be so ingrained in us that it is automatic, and every time we see a patient, we will hand rub before we touch the patient.
Every hand rub protects
our patients from
Potential health complications
and even save lives.